Good morning and welcome to Tuesday Morning Zoom. Whoop, whoop, Zoom day. Okay, so I have a couple of announcements. Our module ends Friday. So we'll have until Sunday to get all assignments in. So if there's something that you didn't get to and you want it to be reopened, text me or email me and let me know, and then I'll go in and open it and let you do it until I'm sorry, I got distracted. Keep it open until Sunday. Oh my goodness, y'all. Once I get off track, I can't seem to get back on there. So that's the end of our module. Next Monday, we will start module 152, which is our step-by-step manual. We've been in that before. It's the blue book, and we'll be doing the beginning of it. So we'll be starting with HIPAA again. We go through HIPAA. This will be the last time y'all go through HIPAA, but HIPAA again, and then we'll move into the ICD-10. So that's going to be fun and exciting. Next week, we have school Monday, Tuesday, and Wednesday. Then we're out Thursday and Friday. 4-day weekend. Whoop, whoop, whoop. Me too. I'm excited. I'm ready for that 4-day weekend. And on this coming Thursday, we'll only be doing Zoom at 11 o'clock. There won't be an evening Zoom. So that's all of our announcements. So we're going to be talking about, well, we're going to be moving into chapter 15, medical insurance essentials. And a lot of the things you're going to be reading about are some of the things that we've gone over, such as the co-pays and the co-insurance, but we're just going to get a refresher on that. But specifically today, we're going to be talking about EOBs, explanation of benefits, and how to kind of read those. So that's where we're going to start. Can y'all believe I have a Google slideshow for you? I know that's so unusual. I did put us some inspirational quotes up to start our day out. Note to self, all you have to do is show. Be late, be scared, be a mess, be weird, be confused, just be there. You'll figure out the rest as you go. You just got to show up. And the other one says, it doesn't matter who you are, where you come from. The ability to triumph begins with you, always. And that's by Oprah Winfrey. Hang on just a second. Kenyana's saying something. Just 1 second. Bear with me. Yes.
I was just saying at the end, could you show me which book?
Absolutely.
Thank you.
Absolutely. Well, I was paying attention. You did send something. Okay, so chapter 15, the basics of health insurance. Now, this doesn't show up really well, but you're going to see this link on today's assignments. And I want for you guys to copy and paste that link in and listen to the things that she has to say about medical billing, vocabulary, and key terms. So the first thing we're going to talk about is what is an EOB. So let's watch our little.
An explanation of benefits, or EOB, is a paper or electronic document you receive after you see a doctor or other healthcare professional or get medical services or equipment. You'll find information about your claims, payment information, and more. Your EOB helps you understand how your plan pays claims so you know what was paid by Horizon Blue Cross Blue Shield of New Jersey and what, if anything, you owe. Now let's learn more about your EOB. In this example of an EOB, you will see date of service. This is the date services were provided to you. Type of service, which gives a brief explanation of each service provided. Billed amount, the full amount charged by the doctor, other healthcare professional, or facility for each service. Allowed amount, the amount Horizon Blue Cross Blue Shield of New Jersey approved for payment based on your plan benefits prior to the deductible, co-insurance, co-payment, or other member cost sharing, if applicable. Your co-insurance or co-payment amount, the amount you pay to the doctor, other healthcare professional, or facility after you have met your deductible, if applicable. Your deductible amount, the amount you are responsible for paying to the doctor, other healthcare professional, or facility for the service provided before your insurance begins to pay for eligible services. Other carrier payment amount, the amount paid by another insurance carrier, if applicable. Not covered amount, the amount charged for the service that is not covered by your plan. This can be for expenses not covered or in excess of your benefits. This amount may be in addition to any deductible, coinsurance, or copayment. Horizon Blue Cross Blue Shield of New Jersey paid amount, the total amount paid to you, your doctor, other healthcare professional, or facility for the services performed. Message code. This shows the codes explaining how payment was calculated. Subscriber responsibility. The amount you owe the doctor, other healthcare professional, or facility, including any copayment, deductible, or coinsurance, if applicable. You can also view, save, and print your EOB by signing into Member Online Services at horizonblue.com and clicking Claims. To learn more, visit horizonblue.com/EOB.
Okay, so that is an explanation of what your explanation of benefits looks like.
Thank you for viewing.
Y'all know this gives me trouble every time. Here we go. Never wants to let me move on. Okay, so AKA explanation of benefits. What is an EOB? Let me see if I can get this a little larger. That's not larger. There we go. That's better. Our first little thing says it looks like a bill. It smells like a bill. It's not a bill. So an EOB is not a bill. So let's just look at what the process is. You get sick, you go to your doctor, you pay your copay. And this is where it gets tricky. There are 3 parties involved in the billing and payment procedures: your doctor, you, and your insurance company. So, and I wish I could read that a little bit better, but I cannot see that. I could see it yesterday, but today I cannot. But I kind of wanted you guys to see that it looks like a bill, it smells like a bill, but it is not a bill. It's just information. Now, as a medical billing and coding specialist, you're going to have the opportunity to read lots of EOBs. And these are some of the questions you're going to want to answer. What's the date of service? What service was actually rendered? What was the billed amount? What was the amount paid by the provider? What were the discounts, copayment, coinsurance, deductible, amount not covered, and the total responsibility that the patient has to pay? Okay, so this is our first EOB that we're going to take a look at. Now, I want to bring up to you guys that all EOBs have the same information, but they may look a little bit different. So I have a couple of different ones, and we're going to kind of go through these questions that we were just talking about. So in this EOB, if you look under 2, it says service and product, and they were doing immunizations here. So 3 is your date of service. So many times, or all the time, one of the most important things in billing is the date of the service. So what was the amount that was billed? That's under number 4. You had $21 for one immunization and $32 for the other immunization. So number 6 says the network discount. One was discounted $4.20, which made it $16.80. The other had no discount, which made it $32. The total for these immunization is $48.80. Then you have the column in 8 that said amount paid by another source, and there wasn't any. Then you have your total plan discounts and payments, which one says 21 and one says 32, but I'm not real sure. We don't really deal with that line. Okay, but let's go to number 9. Let's look at your copay. How much of their copay did they pay? None. How much deductible? None. How much coinsurance? None. Not covered? None. Your total responsibility is 0. But then it says claim notes, PPC. So I don't know if it's, it doesn't show it here. Oh, here it is. It says claim notes, PPC. The charge exceeds the amount ambulatory payment classification. If you are working a denial, this would be why it was denied, but this isn't a reason to be denied. They're paying everything and the patient's responsible for 0. But if you look here, my deductible summary, your carryover deductible is $500 in network deductible, and it gives you extra information here. So if you are looking at that as a billing and coding specialist or a patient, how much do you owe on that EOB? Nothing. Everything is covered, right? So that's why sometimes that it doesn't really matter, because it comes out to 0. It doesn't matter what they discounted or what they didn't discount or this or that, because at the end, what you're looking at is total responsibility. And patient always wants that to be 0, although it's not always 0. But if it wasn't 0 and the patient wanted to know why they had to pay, you as a billing associate would need to be able to look at that EOB and say, oh, well, the reason it didn't pay is because of, and that charge code, if there wasn't an amount paid, it would tell you why. Patient has exceeded maximum allowable charges for the year, whatever it is. So just knowing where to find the information and what we're looking for, that's what we're looking to do, not necessarily understanding denial codes or anything like that. Those will be on the job training, I promise you. All right, so let's move on to our next. Okay, so this EOB looks a little different, doesn't it? So the date of service is 5/19/2014. And then let's look at column 2, where it says, what are the charged amounts? 102, 36, and 30. Well, the 102 is for a medical care, which is an office visit. It was probably a 99212. If you've been through E&M coding with me, you'll recognize that. If not, don't worry, you will recognize it later. And then you had some labs done, which were $36 and $30, which brings it to $168. Then it goes into network savings, saved $40. And then it says the health plan paid $113. 0 is added to deductible. They paid a copay of $15. Coinsurance is 0, and amount covered 0. And then you're responsible for $15, which is what? That $15 their copayment, isn't it? Do y'all see right here? Oops, good gracious, y'all. Y'all see right here where it's $15? So all that this patient needed to pay was their $15 copayment. Everything else was taken care of by insurance. Make sense? Make sense? Y'all,
yes.
Y'all got to tune in.
Yeah, it makes sense.
Yes.
Okay, so here's a Blue Cross Blue Shield EOB or claim summary. It looks different, doesn't it? This is for physical therapy. These are our dates of service. These are the charge amounts. These are the allowed amounts. This was the copay, and your balance is $25, that copay. Boy, they're being nice to us today because they didn't have anything extra. Everybody's met their deductible. So I want you to look at this though. This is the charged amount.
Mm-hmm.
Look at the allowed amount. They can charge what they want, but they're only going to get the allowed amount. Look at the difference, $81.31 and $225. So you see the difference in those two numbers? It's a vast difference, isn't it?
So is the allowed amount paid by the insurance company?
Not necessarily. It just depends on the actual scenario. Here, the insurance company paid, but the doctor has to write that part off. Do you know when this part would be the full amount? Is if you were a self-paid patient and you did not file for insurance or didn't want it filed on your insurance, you would owe this amount instead of this amount.
Okay.
There are different reasons why people do this, don't want their insurance claims filed. So you have to just, you know, some people don't want their employers to know certain things, or I don't know. There's lots of different things, but all right. Now we can't see this, but I just wanted you to show you the way this Blue Cross Blue Shield explanation of benefits looks. Much nicer than the last one, correct?
Right.
But you can see this patient's responsibility is like $518, but I'm not going to make us strain our eyes to look at that. And if I made it bigger, it was blurry. So I just wanted to see you how this is a really nice one. This is the kind that I want to see. And this is an A Aetna. So again, let's take a look. This is the patient's name. This is who the medical doctor is, patient's account number, patient's ID number, member ID number. So you're going to be able to glean lots of information from here. These are your dates of service. These are your CPT codes. This is what the charges that they submitted. This was the allowed. This is the copayment amount. This was the co-insurance. This patient had not met his deductible, so that's why he's going to owe more. So, and the patient's responsibility is $126.67. And they're asking for payment of $150 because when you add the co-insurance in with this, you get $150. So they're going to add the co-insurance in with that. They'll pay their copay at the doctor's office, but that doesn't go towards anything. That's just the predetermined amount that they your insurance contracted the doctor with, is what you're going to pay. So the total payment that Ellen Smith needs to pay is $150. Make sense?
Makes sense.
Do you feel like you know what an EOB looks like more and what information you can get off of it?
Yeah.
Yeah. EOBs are important, guys, because when you get a denial, if you charge something incorrectly, you're going to get a form that looks almost exactly like an EOB. It's going to have all the same information on it, but it's also going to give you a code that says, hey, we didn't pay because the date of birth doesn't match. Or, hey, this is not a member of our insurance group. Maybe you may just have transposed policy number, or they may have a new kind of insurance, but that looks almost identical to your EOBs, except it's going to be listed with lots of names. So if it's Blue Cross Blue Shield, instead of just having Miss Ellen Smith on there, it's going to have maybe 50 names on there, and you just read it just like you do the EOB. So I wanted to make you guys aware of that, just because I think it's important to be able to look at those documents. Okay, now we're going to review the birthday rule. So what is the birthday rule? If a child has insurance coverage from both mom and dad, you use the birthday rule to determine whose insurance is billed primary and whose insurance is billed secondary. So let's look at our scenario. The mother's birthday is April 23rd. The father's birthday is February the 9th. Who are we going to use as primary insurance?
The father.
And that's because his birthday comes before mom's birthday, right?
Right.
Okay, so keep that in mind when we look at our scenarios. The patient is a 3-year-old. Both parents have private insurance coverage on the patient, and the mother has a healthcare savings account. The primary insurance belongs to the parent, who was born first, the oldest, with the healthcare savings account, with the earlier birthday in the year or with the best insurance benefit coverage? Whose insurance are we going to use using the birthday rule? A, B, C, or D?
C.
It's C, with the earlier birthday in the year. Okay. A child was seen by her pediatrician. The child is covered under both her father's and her mother's insurance. According to the birthday rule, the mother's insurance is primary, but why? The mother is older than the father. The mother's insurance has a lower deductible. The mother's birthday comes first in the calendar year, or the mother's insurance has a higher coverage rate.
The mother is older than the father?
Nope. The
No.
mother's birthday comes
Comes
first
first.
in the
Okay.
calendar year. I know it makes you, it's a head scratch.
Yeah, it makes you think.
You have to really think. Okay, so this one says, which of the following statements is true concerning a court order about children's health carriage after a divorce? Now, this is our little curveball. I'm going to tell you, divorce rulings by a judge trump everything. So if you have a divorced family and the divorce decree says dad pays insurance, then it's going to change. It's going to cancel out the birthday rule. So which of the following statements is true concerning a court order about children's health coverage after a divorce? A, the primary plan belongs to the parents whose birthday falls closest to the beginning of the year. B, divorce rulings have no effect on primary and secondary policies. C, the primary plan belongs to the parent whose policy was effective the longest. Or D, divorce rulings override the birthday rule.
Wow.
What did I just say? Divorce rulings override. Right?
Okay, D.
D. Why does divorce rulings override the birthday rule? It's because it's handed down by a judge. But if there's no divorce, you use the birthday rule. If there's no divorce decree, you use the birthday rule. But if there is an actual decree, you have to follow the divorce ruling decree. And how will you know that? Because the patient's parents are legally bound to provide that information. All right, which of the following determines the primary policy if two plans cover a dependent child? Okay. A, the parent who is the oldest. B, the parent who signs the financial responsibility form. C, the parent who has had insurance the longest. Or D, the parent who has the first birthday of the year.
D.
D.
D, yay! That's right, D. That's the birthday rule, okay? Okay, so this is your assignment. You guys see this EOB? Using the questions we used previously, submit the answer to each of those questions. And it's going to be things like the date of service, this allowed amount, the submitted amount, the approved amount, what's the patient responsibility. So easy enough.
Easy.
If you guys want to get out a pen and piece of paper, I have the questions and I'll read the questions out to you, and then you can just get it off of here real quick. You want to do that?
Yeah, we can.
That way it'll just be easy to submit. Your assignment will already be done.
Yes.
Okay. Okay, so our first question is, what's the date of service on this EOB?
3/3/2008.
18. Yep, 3/3/2018.
18, right?
Right. Number 2, the question is, what service was rendered? How do we know that? By the procedure codes, right? So on 2, you can just write procedure codes. I'm not expecting you to write all 3 of those, but you just need to know where they're found on your EOB. Number 3, what is the submitted amount?
We need all 3 of them.
No, you can just do the total.
Oh. Submit them. Oh, the 170.
Yep, the 170. Okay, what is the contracted allowable? And you could just use that total at the bottom, the 170. What is applied to deductible? And I'm going to shorten the questions. I'm not going to give you total, all of them. So what is the patient expected to pay?
Oh, is it the 170?
Yep. It's the 170. And let me tell you why. This is Delta dental plans. Dental insurance does not pay much. But I want you to look at the copay percentages. It's 80, 100, and 100. So the only thing that the insurance would pay, if they would pay anything, they would pay 20% on this 106. They wouldn't pay anything on these other 2. But that's a little confusing. I don't want to get into that too much. But you guys wrote down the answers to your questions. And you can submit it to me.